We take you now to the White House, where we have learned that House Speaker Paul Ryan is meeting with the president over the GOP health care bill.
Now, this comes as lawmakers debate the measure on the House floor. Moments ago, Democratic Congresswoman Jan Schakowsky shared her appeal against the GOP plan.
The American people are not clamoring for you to repeal Obamacare. Only 17% of Americans say that you should vote to repeal Obamacare. The average American is overwhelmingly wants you to vote no.
And Democratic Congresswoman Jan Schakowsky of Illinois joins us now from Capitol Hill. Congresswoman, thank you so much. How confident are you that the nays are going to have it today if and when this vote comes to the floor?
Well, I don't know. My guess is if I had to bet the House, I would say that it'll probably pass. Either way, I think this is a really bad outcome for the Republicans. If they vote for it, I think that their constituents are going to really be coming after them for taking away health care, for making it more expensive, for putting this really crushing age tax on people who are 50 to 64 years old. And over the last 24, 48 hours, they've just made it worse and worse and trying to get the more conservatives to vote for it. And at the end of the day, we're also talking about a $600 billion tax cut for the wealthiest Americans. Some people think it's really just a tax cut bill for rich people disguised as a health care bill. So this is not what the American people are asking for. I was surprised to see the Quinnipiac poll yesterday that actually showed how very little support there was and how much more popular Obamacare was than their bill.
Yeah, I think it was 56% were not in favor of the bill. Congresswoman, you've said recently in an interview that the Republicans were, quote, looking for a sweet spot and won't find one on health care. What did you mean by that?
I'm sorry, what do I think about? Say it again. Okay?
You had said in a recent interview that the Republicans were looking for a sweet spot and they won't find it on health care. You were saying that, you know, they had said for years that they were planning on repealing and replacing Obamacare and they were ready to do it on day one, and now that we're here, they can't seem to find that sweet spot.
You know, look, they were promising that they would have Obamacare repealed ready on after the inauguration, and they have been trying to get there. They say they made promises to the American people, but the promise they made, if you look at the CBO report, if you look at all of the objective evidence, the facts about this bill, this is going to be a politically dangerous vote if they vote for it. If they vote against it, I don't know if there's going to be the Tea Party money, the Freedom Caucus money is going to try and the Trump money will try and go after them. But regardless, there's just no excuse, I don't think, that's going to work for them for voting for this real dog of a bill.
Congresswoman, you just retweeted a message from Minority Leader Nancy Pelosi, who wrote, quote, every single Republican who votes for #TrumpCare will have this moral monstrosity tattooed to their foreheads forever, every single one. But you just also did say to us that you think that the bill may pass. So what would you say to your Republican colleagues who are still on the fence right now?
Look, you know, they've been talking about, well, this is really just phase one, or the Senate is going to make changes, and we're going to make changes. They've made promises to veterans that the bad policies that are in this bill that will limit their choices of care, that they're going to change it. They are going to own this vote today. Nancy Pelosi has been encouraging them to stay, those who have said that they're going to be against it, to stay against it, whatever their reasons. Certainly the moderates ought to vote no. But I'm telling you, there is not going to be a safe district in this country for people who voted in favor of this bill. It is not worth their vote. And I think politically they're going to see in 2018 that this was really, really a bad choice.
Here's the thing, though. There are problems with the Affordable Care Act. We've all heard from people who say they have health insurance, but they can't afford to use it because their deductible is so high or their premiums are so high. And, you know, even the president issued a statement yesterday on the anniversary of the Affordable Care Act, and he said we should build upon this law. But let me ask you, what can be done to improve the law as written in a way that will appeal to some of the Republicans in the House?
Well, we've certainly, over the last 7 years, tried to say, look, we knew when it was passed. I helped to write it as a member of the Energy and Commerce Committee. A big bill like this, we knew that there would be problems that would show up. And we always have said, let's sit down and fix this. And instead, we've seen the Republicans want to embrace all of the bad stuff that they hear. We hear it too. It would not be hard for us to come to agreements. We could have a public option that could be in competition, to create competition in some of the districts that only have one insurer. And I know that's a problem. We all know that's a problem. Those people who have the higher premiums and can't afford really to have their insurance policy work for them, we could talk about, do we need to do more subsidies for them? Should we have some sort of a different kind of plan available for those folks? But in the meantime, we're talking about disabled people, we're talking about older people, and we're not just talking about poor people. When you look at West Virginia, 1 out of 3 people is on Medicaid in West Virginia. These are Trump voters in many cases. These are people that are going to be so hurt. We have an opioid epidemic. They're going to cut Medicaid that provides substance abuse treatment for those people around the country. This is really a problem for them in their districts. Sit down with us. We can do this across the aisle and figure out some of the improvements to Obamacare. But don't repeal it. Don't do your bill. Don't take away health care from millions and millions of people.
I think that's the question you're posing, Congresswoman, which a lot of people, especially people who voted for President Trump, have been saying. Look, even members of the Democratic Party recognize that there has been issues with the Affordable Care Act. In fact, your hometown newspaper, the Chicago Tribune, wrote a piece about this, why Obamacare failed. And one of the reasons it says here, it straitjacketed insurers into providing overly expensive soup-to-nut policies. It wasn't flexible enough so that people could buy as much coverage as they wanted or afford. So beyond sort of the cosmetic measures that you're talking about here, if you had to redo this bill, how would you have done it?
I would have put in some limits on the cost of prescription drugs. We could have Medicare, and even the president said that. Negotiate with the insurers to bring down the cost of Medicare. In the meantime, this bill reduces the solvency of Medicare by 3 years. Obamacare extended it for 11 years. And so seniors have to worry now about their Medicare. As I say, we could institute, especially in places where there is only one insurer, a public option, kind of a Medicare-like option that people could buy to compete with the one private insurance company. We might want to think about inducements for insurance companies to be able to go into competition in certain districts around the country. But what they mean by flexibility is the flexibility of states to be able to throw people off of Medicaid. It's really an attack on Medicaid more than anything else. And for example, 1 out of 4 births in the United States is covered by Medicaid. And now they've added this work requirement that says a woman who delivers a baby within 60 days has to go find a job or she could lose her Medicaid coverage. Really? Is that why they came to Congress? To kick mothers off of, off of their health care?
It's a question that certainly members of your party have been asking of your Republican counterparts. Congresswoman Jan Schakowsky, we thank you as always. We appreciate your time.
Anytime. It's a pleasure. Thank you.